Hi, I'm Dr. Jennifer Hawks. I just wanted to come on and talk briefly a little bit about men's health, actually. November's coming up, and November is often associated with Movember to have men grow out their mustaches and raising awareness for men's health, especially with prostate cancer, testicular cancer, things like men suicide rates, and things like that. So it's very important for us to actually take a minute to focus on men's health because oftentimes the men are not focusing on their own health. Many of my male patients do focus on their health, and I appreciate that. But more often than not, we get the men that avoid going to the doctor and just don't want to deal with any aspect of that or um, have to be associated with any medical condition whatsoever. So I'm not about labeling any of my patients if I don't have to. Um, so, in general, I would like to invite all of the men to at least go do a check in with your physician. Let them know how you're feeling. If everything's great, then wonderful. You have nothing to worry about. Just go get it checked out, get some basic blood work done, have them take a look at prostate health, tell your doctor about any symptoms that you're having, especially with frequent urination or inability to completely void the bladder, especially if you're having any issues with mood swings, um, lowered levels of testosterone that could be showing up in issues with sex drive, irritability, emotional status. So there's a lot of different things that we have to pay attention to with men's health that we often just kind of overlook. So November's coming up, Movember for all my men. Make sure that you do take a moment to look at that for yourselves and have a healthcare professional take a look at the overall wellness for your body because it is much better for us to be able to prevent an illness or prevent this issue from happening in your body than it would be for us to go back and correct it after it's already created additional damages in the system. So, just as a little tidbit, I get a lot of requests from men that want to know about increasing their testosterone levels naturally. So, I'm just going to give you all a little tip on that. So, when it comes to raising testosterone naturally, you also want to look at whether or not your body is stealing testosterone and turning it into bad estrogen. So a lot of times we'll see where a guy starts to age and he notices, his sex drive drops. He starts losing a little bit of hair. He's noticing he's getting more of that abdominal placement of adipose tissue. You like how I said that instead of the beer belly, right? So when we notice that, we want to really take a look at not only what that person is doing activity wise on a daily basis, we want to look at the nutrients that they're getting in. We want to look at their liver health and liver processing. We want to look at hormone balance, and we want to look at the foods that they're eating and whether or not those foods are actually contributing to promotion of the enzyme known as alpha aromatase. So, alpha aromatase in the body is often only popularized when discussing hormone receptor positive cancers. But alpha aromatase in the body can actually take testosterone and turn it into bad estrogen. So, the very first thing that we want to look at when a man wants to up his testosterone levels is actually looking at foods that are going to promote keeping the testosterone levels and avoid turning those levels into bad estrogen for those men, for women as well, but for those men especially. And so when we look at how many vegetable servings that we're getting in a day, and we're looking at the aspect of cruciferous vegetables, so vegetables that are known to be I3C or DIM, so indole 3 carbinol, basically is I3C. So vegetables that are going to be cruciferous vegetables, broccoli, kale, cauliflower, Swiss chard, cabbage, all things like that are actually known to help block alpha aromatase in the body. So this is not only beneficial for women that have high amounts of bad estrogen, this is beneficial for men that have high amounts of bad estrogen, and or we're seeing that they're starting to develop more estrogen and it's stealing their testosterone levels. So lots more involved than that, but just as a quick tip, I know a lot of men, it seems like one of the only things that they even seem to be worried about with their health is the aspect of testosterone levels. So there's my little tip for Movember for you. But if you'd like to take a closer look, or if you want to actually look at everything that's going on with your health, I do urge you to reach out to your primary care provider or to a local naturopath. If you want to find me, dochawks.com. I'm available for you. Reach out. We'll set something up. We'll take a look. And telemedicine is available for those of my men who don't want to get out and or are too far away from me to be seen physically in person. Look forward to seeing you all soon.